morning. We're super excited to connect with everybody again. We do these once in a while to just present our thoughts on what we're seeing across the country when it comes to social issues. And for those of you that are municipal leaders across the country, welcome. Thank you for taking the time to connect this morning. We're going to get going, knowing that more people are still coming on. So we'll hopefully catch them up as they log in. We're always surprised when people come to these, so thank you for joining us. We'll start with the land acknowledgement, and again, everybody's coming to us across Jordan Island, and I really appreciate that. In most of the communities I go to, this comes so naturally now, and it's an exciting place to be for Canada to take this meaningful action on reconciliation. And today's conversation is no less relevant when it comes to this work. So with that, I'll start with why the heck is a technology company talking about social issues? If you don't know much about us, we're a data software and insights company out of Calgary, Alberta. That's where we started. We're now operating in 2,000 localities is where we have data in Canada. So it's grown quickly. It's grown furiously in some communities as well. But our work is to build solutions that empower leaders that are working on these complex social challenges at the front line. Most of our community partners tend to be lots of you, actually, and that's probably why you know about us. One of the big pieces of work that we do is to develop these technology and software products that align community solutions on complex social issues as well. So I'll talk, very briefly here, just to say if there's ever a need for better data insights, please consider some of these products as well. We are a competitor to big US technology companies, and so you'd be buying local if nothing less. But we're also really excited about what we put together for social impact as well, to just get better coordination, transparency, and impact ultimately. Partners that we want to also thank for some of the insights we've gotten over to prepare us for today as well. Okay, 1 second here. All right, so it's some trends in social infrastructure planning for today. We've got to define this first and foremost. So what is social infrastructure planning? We talk about this as a wide range of decisions that are made by yourselves as level of government, funders, program services, policies, and it's really to do with some of the infrastructure that we have locally to respond to social issues. So we're going to be talking a lot about social infrastructure planning today, because this is really core to today's discussion in terms of trends emerging in this area. So the biggest thing that we're seeing, and like I said, we work in about 2,000 communities across the country where we get data from them on this stuff, is the inflationary pressures and the depression emerging right now. That is historically been linked to major social disorder risks. So cheaper illicit substances carry very high health costs and health risks. When times are tough, people turn to poorer quality of drugs. And so some of these challenges will, of course, come up for lower income households as well as high income households as well. Economic hardship, though, that impacts mental health, obviously, and escalates certain types of substance abuse. So I really don't want us to walk away thinking that it's all going to be the same for everybody. We actually see that this is quite uneven and impacts racialized, marginalized, vulnerable groups at a disproportionate rate in ways that you would expect with other similar challenges that we've seen in past recessions as well. So if you remember back to the housing crisis in about 10 years ago, we now have so much more insights about what happens when these crises take root. So there's a bit of a infographic there just to give you an example, but you can see that certain subgroups in least affluent neighborhoods are disproportionately impacted. And you can obviously understand the connection between poverty and health challenges as well. The one that is really big And we're seeing this pop up all over the place in council minutes, in provincial Hansards, in media, is the concern about public safety. So rising concerns here. Interestingly, not necessarily correlated with crime rates, but the public concern over safety is what's of particular interest. Now, having said that, and as you can see here, police reported crime severity indexes in Canada, we do see a jump in 2021 data. And so that type of insight is an important one to keep in mind as your community is going to follow the same Twitter, it's going to follow the same news coverage in other communities. So it does have that network effect on community concerns over crime or public safety. We see this again in our work with police. This is a major challenge for them. Tons of concern with not enough policing is popping up quite a bit. Of course, the interesting part is this is on the heels of the defund movement as well. So you've got a very polarized community that, some are saying let's defund police or manage police budgets in a different way and reform police. And then there's the groups that are saying, well, we need more police on the street as well. So it's an interesting space for a municipal leader to be, because you're, of course, trying to manage the pressures from both of them. And to me, it comes down to the data. If we see crime rates rise, and if you understand the connection between public safety and inflationary pressures and economic hardship, what are we doing in our social infrastructure to get ready for these pressures getting worse, not better, right? So we're entering a very difficult economic period. That's going to be impacting everybody's wages. We already know the money doesn't go as far. We've seen tons and tons of announcements recently by provincial governments to try to curb the affordability crisis. But that is, of course, going to come at a cost to other initiatives as well. On the crime piece, the other consideration I would say for us to look at as municipal leaders is what's happening south of the border on this. And that's primarily because the US politics will influence our provincial elections and I guess more importantly, the national responses to community safety and well-being as well. What we see in the US, interestingly, is that violent crime specifically is on the rise. And so violent crime is the one that's, it's not the breaking into a car, it's the like you saw the shooting in the clubs, it's the murder, it's the major robberies, etc. The big stuff that makes the news, that gives people the perception that life is not safe right now. So that happening in the US will influence our media. It's going to push our media to continue to cover public safety issues as well. So that's one to look at. The next one I would definitely keep an eye out for all of you, as well as the conversation around homelessness specifically. Again, probably not telling you things that you're not aware of in your community, but what I can tell you is what we're seeing in terms of responses across the country. First and foremost, it's the fact that smaller communities are experiencing what used to be the big urban problem of homelessness, visible homelessness, rough sleeping, encampments. So places like Halifax, places like Abbotsford, places like even Woodlands County. We're doing a project right now in rural Alberta, in a community that sees homelessness as one of their top 3 social issues. The community is only 5,000 people. So we're seeing these issues come up much earlier in the trajectory of a community in terms of their population growth. We used to be something we would talk about when a city reached 50,000 or 100,000 as a social problem around homelessness. We're now seeing in cities of 5,000, as I mentioned before, or communities of 5,000, because they're not technically cities at that phase. So why is this happening, right? What's the changing nature of homelessness? First and foremost, I'll say that the complexity of needs has shifted. And that's not necessarily because of people are, born with new vulnerabilities that we didn't have 10 years ago. It's some of the pharmacological innovations, if I can call them that are available today in smaller communities were not necessarily available to them beforehand. So it's a really, really good example, and I'll use smaller communities as a just an illustrative point. The ability to secure drug supply was largely dependent on organized crime traditionally coming through a particular community. And when we tend to know who those gangs are that are moving product in the community, and can tend to manage that more or less based on our police interventions. What's happening now, though, is we have this ready supply that can arrive by mail. And it's extremely has become very easy to purchase the chemicals needed to basically create your own supply in very, very small cottage industry type projects. We're starting to see some of these busts, but again, with smaller supply, and with some of these pharmaceuticals being small but very powerful, you can transport them fairly easily through the mail, unfortunately. So we're starting to see these pop-up startup organized supply or vendors that are not our usual suspects in terms of how our response has managed them. So those types of interventions at that local community level, in terms of how do we even identify that this is happening locally, need to shift as well. And the reason this is connected to homelessness, of course, is because we know that there's an entwinement between addictions, mental health challenges, and that rough sleeper mental health plagued population, unfortunately, and that's not getting better because the drugs are getting so much more powerful today. So if you'd ever have a chance to chat with your frontline folks, your first responders, your ambulance, your fire, your police, protective services, and your shelter staff, they will probably, and you ask them, would you rather have meth or would you rather have alcohol? They would jump up and down to go back to the good old days of alcohol. So those drugs that are now circulating in the vulnerable population are making it much tougher to get people out of homelessness, and the types of addictions and their impact on just brain health and somebody's complexity of needs is changing as well, unfortunately. So that's a big one. So that means that the facilities that we have today that were designed for a population that tended to be, or if it was to do with harm reduction, it tended to be alcohol harm reduction, right? Or cocaine, heroin harm reduction. We're now talking about how do you do meth harm reduction when we know that psychosis induced by these drugs and the overdose crisis that's entwined with the fentanyl component is huge challenge. I spent last week in Vancouver, in the downtown East Hastings, and I can tell you I've never seen anything like it. And I come from a third world country, so it's something to keep an eye out in your community. Watch for the meth, watch for the fentanyl, and watch for the cottage industry coming through and creating some of these dependencies on these new types of drugs that have major health challenges. And we're going to reap those negative effects long term, because folks need to have that treatment option to actually get out of this. But on the other side, we also know we have an inflow into homelessness that's precipitated by these economic challenges and the affordability crisis as well. All right, I'm told that I'm talking too much about this, but it's a huge one. It's a huge one. So the other piece to know here too, shifting mandates around social issues. I need to stress a couple interesting insights that I've had, again, out of the Vancouver experience and shaking some stuff up down in that area. So we've seen provincial governments wanting to no longer own the full mandate of social issues. And we see this in the downloading of the responses to all of you as municipalities. That's, you're based locally, understand the local needs, you're probably the best suited to do this work. However, there's an interesting play at that, because you don't control the funding. necessarily to do the response planning and to manage accountability and to right size your social infrastructure to meet those local needs. So whereas you have control over your municipal budgets, you don't have control over the social spending in that community. In fact, only 2% of the money coming into a municipality is in the direct accountability and control over of that municipality. So how can you be responsible for something that you're not necessarily managing the contracts on? The province tends to be the biggest individual funder of the social response, but we're seeing them want to kind of pass this on to municipalities. Of course, you're also the ones that get all the citizen complaints around it too. So your ability to respond and build that muscle around social infrastructure planning is always a challenge because you don't necessarily have the full control. However, what's interesting about this trend in downloading is we've also, because of just more and more of us talking about this challenge around who controls the money, we're starting to see some of this stuff shift a little bit. And the biggest one I can give you as an example is last week, Premier Eby in BC's announcement that he accepts that the accountability for homelessness and the downtown east side challenge is actually a provincial accountability, and stepping up and saying, yes, we're going to take this on. It's too much to ask a city to do on their own. That's a big shift away from this downloading onto municipalities. Knowing that though, of course, you don't want to lose full control over what's happening in your community. So being ready for these kinds of moves around re-centralization is going to be something to watch for. I'm curious to see if what happened in BC last week is going to start to have a ripple effect in other parts. And I'm already starting to hear murmuring about this in Alberta as well. But let's see how it shakes out for BC moving forward. So here's a municipal administrator. We get the privilege to talk to your teams all the time, but this is just a representative quote from this conversations we get all the time. So service staff needs, they change every day. So when I get a request from council about what we need, I'm not sure where to even start. So this is just speaks to this need to be on the fly, responding to social issues that you don't necessarily have capacity to do much about because you don't control the budget, but you still need to know what's going on and what the policy levers might be. What else we're seeing is this move away from single issue responses. If the downtown east side doesn't paint it for you, how entwined poverty and addictions, violence, intergenerational trauma, racism, all these issues are no longer acceptable as siloed responses. So more and more, we're seeing a move away from a homelessness strategy or an affordable housing strategy, and then a domestic violence strategy. We're starting to see these approaches to community safety and well-being. Some call it social infrastructure planning, some call it social policy responses. However you want to term it, it's usually a combination of these root cause components that are met with strategies and tactics that are meant to not be siloed or issue specific. They're trying to tackle the challenge from all of its complexity. That's new, that's exciting. We've been talking about this forever. It's really cool to see it pop up and to be part of that infrastructure response that's not one-off. So of course, when you get into being holistic, the complexity of the network becomes almost overwhelming because now you're not talking about coordinating for homelessness agencies. You're now having to coordinate possibly 200 organizations with 5,000 programs. So it does absolutely hinge upon the muscle of the municipality to also grow as demand for systems responses shifts towards this unsiloed model. So our challenge now is how are we going to turn these aspirational objectives, such as these community safety and well-being plans, into concrete and measurable proof that we're doing what our community asked for. So this is the community safety and well-being lead in one of our communities that we work in. So these plans are fabulous. They're actually mandated by law in Ontario. They're starting to take root in BC and actually saw a couple of them in Alberta, just because we've been involved in them personally, but Saskatchewan similarly. Folks are starting to move towards these strategies, but they're highly aspirational. The challenge now is to show outcomes at that community level for the investment made in that planning. The other consideration here too, the post-COVID infrastructure impact. So we've had unprecedented investment in the social safety net during COVID, CERB being a really good example, but so much more investment in things like conversions of hotels, motels into shelters, creation of immediate drop-in or food center capacity to respond to that immediate need. Well, all that stuff's starting to get rolled back, right? So we opened up a bunch of facilities, we opened up a bunch of new services. Now that money is starting to come home to roost, if you will, because now we have to figure out how to scale that back while we've been advertising and getting clients to come through. So patterns in service use. Emergency food sector is and will continue to be over capacity. Of course, that's related to the inflation pressure, the engagement hesitancy of folks coming in person, and some service providers still kind of being used to doing things online and not wanting to necessarily come back into the office. We actually see some of that reluctance as well, that I want to stay digital. Interesting. The charitable sector itself experiencing higher than usual turnover. And that's, again, the low retention is widespread. But again, because the charitable sector can't really keep up with the inflationary pressures, it makes the alternatives even more appealing for their staff. And when you have the medical system or the public sector having higher wages and massive shortages of staff, you're going to cannibalize your charitable sector much more efficiently, unfortunately. So if you haven't seen it, lots of urgent calls around charitable funding, especially as this money gets clawed back. Folks are getting let go. Other folks are jumping ship because it's seen as a volatile sector as well. All right. And then the last some of these I headline myself, unfortunately, with my infamy in some of these circles. But the call for transparency around outcomes is a huge trend, and that comes with a double-edged sword. One is, of course, that it's going to impact all of us as more demand comes from the public in many ways around transparency. Our ability to defend budgets and show data, show proof of the value proposition to our end users and our taxpayers. I really don't see this going anywhere. I'm really seeing it ramp up. If there's one thing I can leave with you, it's this call for transparency around outcomes is going to be a major story in Canada moving forward. And if you don't believe me, there's been 3 audits, one of which we were involved in Vancouver, actually 4 audits in the last week that hit the media showing concerns around social spending and how value for dollars is being realized. And so this uptick in calls for transparency is going to be an election issue nationally. It already is. The Auditor General's scathing review of Infrastructure Canada, CMHC, and Reaching Home around homelessness is, if you haven't taken a look at that, I encourage you to take a look and see what the comments are from the Auditor General on it, and start looking for this in your own community, because of course the media is going to continue spinning these stories, and more are going to come out. Same as in Vancouver, you have one report that then creates this watershed moment, and a bunch of other stuff comes up, and now it becomes a provincial challenge. So I would definitely make sure your house is in order when it comes to data transparency. I would make sure your house is in order when it comes to social return on investment and the ability to track your investment into client outcomes. So it's no longer good enough to say, well, I invested a bunch of money in these organizations. How many clients do those organizations see? Were those the same clients? Right. So is my funding going to fund something that is serving the same people, just at different doors? What is the impact of my investment on client well-being? Are they ending their homelessness and not coming back? Are they addressing the root causes of their addiction? Anyways, all of those things are going to be questions that even the Auditor General is now asking of social spending as well. So that's one. Okay, the negative network effect too. So of course we have immense complexity, limited visibility of all the social infrastructure that's operating in our community, because of course municipalities only fund 2% of what's happening. We've got these changing community needs and limited ability to calibrate, because of course we can only calibrate what we can control. We can influence everybody else's investments, but we're not the key holders on it. At the same time, we've got the opportunity to build data infrastructure, or build infrastructure that is data driven, that can explain and anticipate some of these misalignments. So while you can't control everything, what you can control is your ability to respond and to understand what's happening locally. And municipalities are naturally positioned to have that type of expertise. And really, do you want to wait until the province comes into your town and tells you what you need to do with your community? Or would you rather be prepared with you've got your research, you've got your data, you've got your evidence, and you've got your asks? You're going to be much better positioned to control where the conversation goes than if you just kind of wait for Ottawa or Edmonton or Victoria and etc. to tell you what you should be doing locally. So there's a note here too around negative network effects as well. And I love my network science, but it describes this phenomenon when network value declines with growth of usage. So here's another one. When more people are experiencing help, increasing overlapping government mandates, many impacted systems, more policies, 25,000 community social supports and charities delivering an estimated 200,000 programs. So it's just to say that the more of these challenges we have, the more we're going to try to respond, but our own responses complicate the issue further as well. So it's becoming increasingly difficult to manage the efficiency of the social response as a result. We've got lots and lots of great programs. We've got lots and lots of great and well-meaning people. How do we coordinate them all to move in the right direction locally? So the opportunity that we also have today that we didn't even a couple of years ago, even before COVID, is that we've had some amazing and very meaningful advances in digital maturity in the sector, in the social impact sector, including the municipalities that are likely thinking about this as well. So applied AI adoption by industry and function. As you can see in some of these industries, you've got human resources, manufacturing, marketing, and sales. The adoption in all of them is pretty, it's, I'm not going to say it's the best, but it's imagine where the social sector is on this scale. We tend not to even make it into these assessments, right? So this is the McKinsey Technology Trends Outlook. The social impact world tends to be a laggard when it comes to these issues, but these tools are now available for us to start to make sense of the complexity. So we're going to need these tools to move out of this really, really complex situation and to be able to start talking about transparency and outcomes. But we're going to need to amp up our efforts around data infrastructure and our digital maturity ourselves to be using data for evidence-based decision-making. I mean, at the end of the day, the data is the data, but if you don't have it, then you might be in trouble. So we've got more data available for decision-making, but not necessarily the tools. So things like dashboard strategies, capacity, privacy protection, that makes us efficient at leveraging these tools. So the tools are out there, but how do we bring them into our practice becomes the question. The adoption of artificial intelligence is increasing across all sectors to aid in rather than replace decision making. So I don't want anybody to think that, when you go see a doctor, because the healthcare sector is really into AI nowadays, that the doctor is just going to plug in their algorithm and that's how you're going to get a diagnosis. That's not how it happens. It's an aid. It's a way to make things more efficient and a way to give you insights that you might otherwise not see. That's the value add of this work. So the question becomes, how do we use some of these new technologies to reduce social infrastructure complexity, increase transparency, and improve outcomes? It's nothing to be afraid of, right? It's something to be leveraged. So this is exactly what we work in. So I'll be able to kind of at least give you my sense of how we've approached this challenge. And I'll show you our data structure to consider how this lines up with what you might be thinking for your community as well. So, and I'll start with the heart of this thing, and for us, we call it Volto. This is the brain, the neural network of our platform. This is where all the data comes in from billions of sources, right? It can come from just scraping the internet for insight. It can come from crime data, it can come from domestic violence sector data, it comes from homelessness data, social trends that are to do with the TSX, for instance. We track Google data as well. All of that data comes through in this infrastructure, because you don't know if you're missing a really key data set, you don't understand how these things become connected then. So the biggest thing is, how do you aggregate all of this data to give you those insights? Then, of course, you need to think about how you're going to draw out interesting information out of that data that you're aggregating. So for us, we do it through, and you can use whatever tools you want. I'll just tell you what we do. It doesn't matter how you visualize it. It's the ability to visualize on the fly and to be able to answer those policy questions really rapidly. So the days of 2-year engagements and 5-year academic studies to answer a simple question, that's not a thing. We can't do that anymore. We have to be much more nimble in our ability to use the data we have and bring it to insight in days, not weeks. And I would argue it should actually be down to almost instantaneously. That's what we're working at least towards. So for us, it's this data insights platform. So the ability to draw these insights out for business decisions on the fly, the ability to respond, and then to have that data set ready for us to do social infrastructure planning and scenario modeling using data, not guessing. But of course, none of this stuff is valuable if you're not getting the information at the client level as well. So who is experiencing challenges in the community? How many people are we actually talking about? What exactly are their needs? Do we actually know that? And I'm not talking about one organization knowing that about their clients. I'm talking about the entire city, municipality, and all of their partners sitting together and looking at the spread of needs using real client information and actually having a de-identified data that's protected, but still able to give us those insights about who needs what, when, right? Because otherwise you don't really have demand information. You don't really know what you're referring to. Are you talking about 300 people that need housing? Or are you talking about 3,000 people that need housing? Well, if you're getting 30 people per organization, but it's the same 30 people, then you're going to completely miss the mark on that. So that's for us, it's this client data management and reporting piece that's super, super critical. But of course, that's not enough either, because what else you need to understand is how people move through the network of supports locally. I don't care who funds them. In terms of organizations providing services, I still need to understand how my end users are interacting with diverse organizations, police, health system, right, immigration settlement, social services, early childhood poverty reduction programming, et cetera. Who is getting what, and what are the outcomes out of those interactions at a network level, right? So not just one program at a time. That's great. That's important. But how does that all add up to social outcomes at the community level? So that's, for us, we call this our work around referrals and the system of care, because that's where we also are able to see how people patch together their journeys and where we have bottlenecks in the network of care as well. And then, of course, none of this stuff is relevant if people have no idea what's available to them when they need it. So, how do we take all of this social infrastructure and spread that knowledge across the network of communities and across the public that might be in need of these supports? I did a piece of work in a community in Alberta most recently, and we talked to them about, or we asked the population in a representative sample of what they use, where they go, and I kid you not, no social organization popped up in as being the place that they go to. They mostly went to their primary care, their school, their faith community, and importantly, their friends and family when it came to social needs. And I'm not talking about little social needs. I'm talking about mental health and addictions. I'm talking about homelessness, and I'm talking about domestic violence. So, how do we then right size our network and right tool our network to account for these natural movements in our population? So, if that's where they go for help, what are we doing to plug into that to support some of these preventative measures earlier on? So, for us, how do we do it? And I'm not telling you need to do it this way. Our job is to make data readily available, serve it up in easy, cheap, effective ways. And there's no way to do that without artificial intelligence. Unfortunately, there's way too much data out there, and it's way too dispersed and not done in a consistent data framework. And so we're missing so much opportunity if we don't leverage some of these new tools. So we had to develop algorithms to read the data and parse the data. We had to develop new taxonomies, new processes. Again, a bunch of terms that we could get into if anybody's really into it. But essentially, how do we take all of this data, process it, and actually serve up insights so that communities can do a better job planning and understanding what's happening on the ground? And that includes all of the work I mentioned before. But again, it's not for everyone, and it's not necessarily the only way to go. It's just how we've gone about it and what we see our value add to be. But when you don't take such a more precise data driven approach, you're missing something. And I'm going to explain this in the area that I'm the most familiar with, which is the housing continuum. So back in the day, and when I say back in the day, this is still the standard, actually, we talk about this housing continuum of, we go from homeless shelters and we go to emergency shelters, transitional housing, supportive housing, market housing, affordable housing, et cetera. We talk about this housing continuum. And then we try to model, and I'm guilty of it myself. If you look me up, you'll see I've written tons of these plans around homelessness and ending homelessness and what do we need of each parts of the continuum. And for lots and lots of reasons, this has not really materialized in a homelessness response that has reduced homelessness in this country. In fact, it has potentially, and some critics would argue that we've sometimes made things worse because we haven't taken a precise approach in exactly what the client needs from a holistic perspective. We're focused too much on the housing piece and not enough on the mental health and addiction support, or we focus too much on the crisis response to chronic homelessness, and we haven't focused enough on poverty reduction and those inflows into homelessness to begin with. And those are all true truisms, but they're having a manifestation today, and that's in some ways what you're seeing on the ground. So what can we do better with some of these new technologies and taking a different approach to it? And I'm just showing this to you as an illustration to compare this to this. Okay, and there's actually a lot more precision in here, but thinking about the comparison being things like precision medicine, so this personalization of what's prescribed to you, and even genetics-based medicine, right? So the ability for the healthcare industry to become much more personalized so that it can target exactly what that patient needs when they need it really specifically. To do that well, you need to rethink how you structure your social response. And it has to become much more sophisticated and precise. And I know we're all short on time and short on resources, but that's exactly why you need to do it this way. You can't, you don't have the luxury to not be precise. right? So what I'm showing you here is just a one little kind of overview of some of our housing taxonomy terms. But what's interesting here versus here is how much more detailed this stuff becomes. And as we become much more sophisticated in our data approach, we can start to say, well, actually, what you're really, really short on in this community is not emergency shelter, but it's actually shelter diversion and housing safety programming. Or what you're actually short in here is rent geared to income housing and moving assistance, right? So, and this is just the housing component. We need to be doing that for all aspects of our well-being as well. But it's just to say we need to get much more savvy. And when government comes in from the provincial and national level and says, here's a bunch of money we're going to invest in your community, you being ready with your wish list of exactly what you need where is going to position your community to be much more discerning in how you take in some of those investments. Because the worst thing you can do is take the wrong thing and make things worse as well, or not be ready to take advantage of the funding opportunities that arise. The other side of it too, on the client end, is having a much better tracking ability to see what happens to clients from these investments as well. So characteristics of clients become really important, and the tracking of changes in their state. So are they experiencing homelessness today? Are they newly housed, own their home? There's a bunch of ways to cut the data to be able to answer the questions if they're becoming are doing better as a result of the intervention or not. Right? So that ability to track at a client level the impact you're having is going to be really powerful in right sizing and ensuring that the performance of your service is on point. And if you ever get resistance to being data driven, I was just talking at a Calgary homelessness event last night about data, and what I loved about again, maybe it's just Calgary, I don't think it is, but the homeless serving sector is used to this type of conversation. We've been having this for a long time, and so I think social sector organizations that are leading edge embrace data and embrace continuous improvement and embrace failure. And I think you as funders painting the picture that data is not a way to be punitive. Data is a way to improve the system so we get better outcomes for our community. And that's good. So failing is good. Failing quick, learning from it is even better, right? And failing and then finding that breakthrough solution for your community is best. So how do we get there to that breakthrough solution faster becomes the name of the game, not whether we should track data or not. That I just feel like that ship has sailed and we've just got to get on with the work. So how we do this, and I'm just showing you some examples of what you should expect from your data providers as well, is the ability to start answering some of these questions. Things like how many mental health organizations promote a focus on trauma-based care? So your data should be able to answer that on a dime, right? What percentage of organizations in my social infrastructure are religiously based? And why do you need to know that? Well, because I need to understand if I'm creating any barriers for folks that are not interested in faith-based delivery. Okay, what about Indigenous specific supports? Who's doing those, and what exactly are they delivering? And exactly what is being delivered gives you a much better sense about what you might also be missing, right? And here's the interesting stuff. How do you know what the gaps and duplications are? If you're only funding 2% of the ecosystem and you don't know who else is funding what, then how are you going to coordinate for maximum impact? How do you know that you're getting value for investment? How are your community members going to have confidence that social spending is deployed to the right folks at the right time and you're getting those results? So I'd say what we've done well, I think, is paint the picture that we need to become much more precise. What I think is also interesting, and what you can see on this chart too, is when certain types of services are not available either. So you can see in this is one community that we're working with, and on the left-hand side, the service coverage, you can see some of the available big categories. But if you drill down into mental health and addictions, you can start seeing things like, how many are actually doing alcohol use disorder medication? How many are doing drug use monitoring? Who are they, right? Who's funding them? What about harm reduction? Let's drill even further. When I say harm reduction, what do I mean by that? Are you doing harm reduction supplies? Or are you doing an opioid replacement program? Are you doing a managed alcohol program? Like, let's be really, really, really specific about what we have and don't have, right? So the dots on the left, the more the dot is on the left, the less of these things they have. And you can start benchmarking against similar sized communities to say, you know, probably the reason we're seeing more people on the street is because our profile of services and our service coverage is not on point. We're missing these critical elements. So when province comes in and says we want to invest in mental health and addictions, you say, yeah, specifically, I need 10 more spaces of this, 2 more programs of that, and here's how I'm going to measure results for my end users. Same thing when it comes to demographics as well, and age. So the ability to look at coverage from an equity perspective is absolutely essential. You might have the best system ever for seniors, right? And then we're wondering why our kids are not doing as well. Well, because the service continuum for the age range that might be missing is not being worked on. And again, I'm not saying that you're going to automatically get a bunch of cash and are going to be able to make up these gaps, but you've got to know the gaps, right? You got to know what your advocacy needs to look like. So with that, from supply mapping to impact, and I talked lots about what's available. And what do you do with that? If you understand what the data needs are, if you understand the pressures on you and what the trends are moving forward, this constant need for accountability at the same time as complexity of needs and communities becoming challenged with new pressures from the economy and the affordability crisis, the methamphetamine, fentanyl challenges that we're seeing very, very much in all of your communities. Let's say, and this is just an example of a goal, you want to advocate to the provincial government for increased investments in mental health and addiction. So I'm picking on that one, but it could be any area of well-being. You know, just to start from the beginning, in basic economics, you've got supply, you've got demand, you've got calibration. So the supply, so what supports are in your community around mental health and addictions? You need to know what you have to know what you need, right? So the very basic supply analysis, the data you need to have should at base minimum tell you those, answer these questions. Which organizations and agencies operate those services, right? How much investment is currently being made in these supports? How does my service mix compare to other communities of a similar size, right? So am I out of whack in a particular area? What's the capacity of these supports? What's their total occupancy? I can't tell you how many communities we've gone in that said, we have no mental health and addiction services. And then we find a bunch that nobody knew about. Or we don't have enough of this type of support. We have massive wait lists for counseling. Okay, in that type of program. But did you see that this program has 0 wait lists? Why are not referring to them? Oh, I didn't know that they had free space. Well, that's, you know, those are low hanging fruit around supply optimization that you can do if you understand that supply. Importantly, though, what's the impact? What are the client outcomes in this subset of supports? Are clients improving? Are clients using these services? How many clients are using these services? What other services would they need to fully benefit from a counseling program? Well, it's not that great to be counseled if you're rough sleeping, right? So what combination of supports get us those better client outcomes? That impact analysis is really crucial. That also tells you the high performer organizations in your network of care that you can really double down on when opportunities come up. Demand. What's the current demand for mental health supports? What is the expected demand for mental health supports? So you know what it is today. What's it going to be in 2 years, in 3 years, in 5 years? Because as we all know, making these pitches to the province are not going to materialize overnight. So you need to right size your ask, but you also need to future-proof your ask so that you're not then caught in 2 years with money that actually was never going to be enough because you haven't accounted for the next 2 years of continued growth and complexity and need. How does our system differ to help people experience addictions versus what they want? So that's one thing to say what the service providers and government thinks should happen. What do the end users want? Very, very basic stuff. You'd be surprised. And the minute we stop asking, we're probably going to design a system that people then say, nah, I'm not going to use it, or it's not easy to access. Oh, it's too complicated, it's too complex. Well, let's stop doing that. And then, of course, how do we balance the supply demand? So which specific supports do I actually need more of, and over what time period, right? So it's not just, oh, I need more mental health and addictions. No, no, no. Let's get really precise. When, how much, what are they going to be doing, and for whom? And investment modeling. What is the estimated cost of bringing these supports into my community? And let's not make up numbers, right? Let's take a look at industry benchmarks. Let's take a look at value for investment. What exactly should we be paying for this? And what types of outcomes for those dollars should we be expecting, right? What's our shortfall? What do we have? What do we need? How do we pay for it? So the opportunity here is to build a foundation with data that you can regularly ask these questions, so you don't need to do these needs assessments every 5 years, because as you can tell, and COVID showed us that, we cannot wait 5 years to respond, right? We need to be much more nimble and agile in our work. So with that, I know lots of you have asked us about our future communities as well, and where we're going to be working in 2023. We're just in the middle right now of 2023 strategy. We have, for better or worse, created ourselves the best problem, which is to be busy. But with that being said, we do think we might be able to accommodate up to 10 communities in 2023. So those of you that are already in our cohorts, we're good. We can continue to be serving you in 2023. We've been able to secure some additional funding for some additional R&D work, so that frees us up for some additional cohorts as well. So if you are a community that's looking at this and you're not afraid of some controversy around data conversations and transparency, and I know that's not for everybody, but by all means, we're looking for specifically experimenting some new tools in 2023 with communities that have high levels of urgency of social issues and community harm. So if this is not a major thing for you and might not be a good fit with what we have in mind, we're looking at building that social infrastructure planning capacity with municipalities that have kind of very, very pointed challenges around community safety, mental health and addictions, homelessness. And it's those that are looking for that measurable goal. So all the stuff I talked about, if this is like your jam, then connect with, actually don't connect with me, connect with Jesse. We'll follow up as well and remind folks if they know communities that have these major challenges. So mental health, addictions, rough sleeping, safety concerns, we're looking for 10 that are willing to experiment with us. So if you're one of them, get in touch. If you know somebody else that might be in game for some disruptive innovation, definitely let us know about them as well. And those of you that are already working with us, you already know all of this work. So thank you. I think that's all I had. Let's see, Josie, did you want to tell me some of the questions that we had from folks before we let them get back to their real work?
So far, no questions have come in, but we'll give.
All right. Okay.
Oh, there we go. We got one.
Okay, we got how do we do supply mapping? So good question. Supply mapping is done through we have what's called a systems mapping team and a systems mapping set of tools. It's a combination of algorithms, and we affectionately have named our AI Doug. His name is Doug. He's got a personality. So we do that through a combination of scraping and parsing public data sets, and then through a process of engagement with the actual service providers to ensure that the listings are accurate and get deeper information. There's lots of things we can get from the internet, but there's more things we can get through that direct tool between us and the service provider. So that's how we do it. We're actually looking at something interesting right now with the federal government around emergency shelters and transitional housing. So I was just doing that scope of work, and I had to describe it. So I was ready for that question. Any other questions, folks? Hopefully this was useful. Hopefully, oh, there's another one. How does this work with an individual service provider and helping to inform practice while also providing this data to the system? Oh, I love it, Alex. Good one. So the individual provider has almost their own version of this of the software, so that they can understand, here are my clients. Here's who else is working with my clients. Here's my outcomes for these clients. Here's where I'm referring them, and who's referring to me. So they have visibility then of the entire ecosystem and how they fit into it. But then they also see their own roster, right? Because not everybody needs to see everybody's stuff. In fact, that's like bad privacy practice anyway. So you want to have that ability in your whatever software you choose. You don't need to go with us by all means, but in whatever software you choose, you need to be able to give the organization their data to manage their business in an efficient way, but allow that organization to plug into the network so that we can then pull those insights at the community level at the same time, all while respecting privacy of the individual. So absolutely, that's 101 of choosing your platform, is to have that functionality that you're referring to there, Alex. So you should definitely be looking for that as a business requirement. Thank you. Yeah, you're welcome. You're welcome. Other questions?
There's one more, Alina, just a question about how to help orgs to design their service menu with precision taxonomy.
Yeah, that's a really, really good one too. So organizations in the social impact world, we tend not to have very good common language frameworks as well. We don't have to really unpack that much further than to say, when somebody says poverty reduction, it doesn't necessarily mean the same thing as the next organization. So part of implementing your software is a process of ensuring you have that common framework, right? So that ability to break down exactly what each organization does at that level of detail that I talked about before is really, really critical. And that needs to be reflected, of course, in your software, right? So you can then, have your software ask completely different questions, or the whole exercise is a moot point. Okay, any other questions that I haven't answered yet? Oh, yeah. So data collected is given back to the user, and they can reuse the data, and the organization owns the data and be able to use software, but it belongs to the org. Yeah, of course. Yeah. And actually it also depends on the client, and because the client has their own rights to data as well, right? So there's data sets that we have in HelpSeeker that are our data. So data that we create. There's data sets that we have from public sources. So Canada Revenue Agency, we love that data set. That's open data. No, nobody owns that. It's the Creative Commons. But then there's client data, which is really the client has some sovereignty over their own data. And then there's organizational data, which the organization owns. So your software is like, it's a software, right? It doesn't automatically own data. It's just a means to manage your data. Now, not to say that the client could come in at some point and say, I want my data removed from that system. So you want to make sure whoever you end up working with as a software provider has that ability to allow for that. And new privacy legislation and GDPR in Europe are making that really, really clear, that the client needs to have much more autonomy over their own data. So definitely consider that. Don't just consider the organization's right over data, consider the client's right on their data as well. All right, what else? Any other questions?
There was a comment from Rika that she says, so the data collected will be given back to user and they can reuse the data, and the organization owns the data and be able to use your software, but it belongs to the org. Yeah,
that was my comment there. Yeah, and it's just a note that the user, if it's a client we're talking about, that the client has their own there's rules around client ownership over their own data and what they can do with it versus what the organization can do with the client data as well. So you need to balance, your software needs to be able to balance client and organizational rights and responsibilities in accordance to, obviously, to FOIP and PIPEDA, Health Information Act. And this is one that folks don't necessarily fully grasp. There's a lot of organizations in the social sector that are not subject to any privacy legislation, which makes it really, really interesting to work in that space because they're not necessarily private sector, but they're not necessarily FOIP because they don't get government money. What we have done though, because the data we get, and again, this is us, it's not the same for every software. We have just chosen to build to health standards. We said those are the most stringent regulations. Let's go with that. It's best practice. So we've taken a Health Information Act level of privacy because we think that's where the client's data needs to be at. But that's not always that's beyond what is legally required sometimes. But it's best practice for sure. Okay, I saw another one. Informative session. Okay, thank you. Good, good, good. Okay, what else do we got there, Josie? I saw a couple more. Problem accessing.
I think they've all been answered here.
Yeah, I think so too. Oh, yes, somebody said I went to HelpSeeker.org. We are just relaunching our website today, so you won't give it a couple hours if you're trying to find us. We're moving from helpseeker.co to helpseeker.org. That's exactly right. So yeah, we'll send the recording today and the slides, and by that point we can get it'll be right up. But thank you for letting us know. We know not a good timing for a software upgrade, but you got to do it. Awesome. All right, I know it's at the top of the hour, so thank you all super very much. And again, if you're one of the 10 that might be interested in this, let us know. Let Jessie know, Jessie at helpseeker.org, and we'll see you next time. Hopefully this was useful. Thanks.